Imagine walking into a modern hospital. Clean steel, quiet rooms, and precise science. If you have an infection, you get a pill. It is a predictable world. Now, erase that image. Step back 2,000 years into the streets of Rome. You are walking through a crowded alleyway. The air smells of wood smoke and open drainage. Suddenly, a blinding fever hits you, or a sharp pain grips your abdomen. There are no emergency rooms, no knowledge of germs, no painkillers. Today, we treat an infection in minutes. Back then, a toothache could end a life before sunrise. Most children never reached adulthood. To survive to 30 was a miracle. To understand how Romans handled sickness, you have to look past the physical symptoms. To them, illness was a breakdown of order both in the home and the cosmos. Early Roman tradition deeply distrusted professional doctors, especially those bringing new ideas from Greece. The statesman Cato the Elder famously warned his family to avoid them, viewing medicine as a paid scam. Healing belonged strictly inside the home, managed by the paterfamilias, the male head of the household. His primary medical tool was cabbage. Traditional Romans used it as a universal remedy. If you had a fever, you ate it raw. If you had an open wound, you mashed the leaves directly onto the skin. They even used the urine of someone who recently ate cabbage to soothe aching joints. To Romans, cabbage meant control. In a world of sudden infection, a simple garden plant gave families a tangible way to fight back. But when home remedies failed, belief took over. If a fever grew worse, the crisis shifted from the household to the gods. Romans believed in the pax deorum, the peace with the gods. Sickness meant that peace was broken. To fix it, families carried the sick to Tiber Island, home to the temple of Asclepius, the god of healing. Inside, oil lamps flicker across stone walls. Incense hangs in the air. Rows of patients lie motionless in silence on the stone floor. This was the ritual of incubation. You slept inside the sacred space, waiting for the god to send a cure through your dreams. The next morning, temple priests interpreted your visions. They prescribed cold baths, specific diets, or fasts. Absolute faith triggered a powerful placebo effect, offering psychological relief when physical options were exhausted. Yet, outside of religion and tradition, a colder science was emerging. If the gods remained silent, families turned to a medicus, a practicing doctor. By the height of the empire, these practitioners operated under the theory of the four humors. They believed the body was governed by four fluids: blood, phlegm, yellow bile, and black bile. Illness meant the balance had tipped. If a doctor decided you had an excess of blood, they strapped you down and sliced a vein, or applied leeches to drain the fluid. No one knew what caused the sickness, only that it spread. Seeing blood collect in a bowl provided a sense of progress. It felt as though the disease was physically leaving the body. While everyday medicine relied on humors and folklore, Rome developed another system, entirely driven by the machine of war. The Roman military realized that wounded veterans were an expensive loss of training and talent. This practical math led to the creation of the valetudinaria organized military hospitals located at the frontiers. These complexes were built for efficiency, featuring isolated wards, ventilation, and access to clean water. Here, military surgeons operated with remarkable speed. Without modern anesthesia, assistants held the soldier down. Surgeons utilized natural sedatives like mandrake root and opium poppy juice to dull the pain, then used bronze forceps, scalpels, and bone saws to amputate shattered limbs. They washed wounds with vinegar and boiled their tools before use. They did not understand bacteria, but they knew dirt increased mortality. It was cold, systematic survival medicine. This created a distinct split in the Roman mindset. A legionary could believe his wound was caused by an enemy curse, while simultaneously trusting a surgeon to cut it out with clean bronze tools. The practical and the magical existed side by side. But for ordinary citizens living in the crowded, multi-story apartments of Rome, there were no military hospitals. Sickness here was highly visible and entirely public. Thin wooden walls meant neighbors shared the sounds of your illness. Death was not hidden behind hospital curtains. It was an everyday reality on every street corner. This constant exposure to frailty shaped the core of Stoic philosophy. Emperor Marcus Aurelius did not write his reflections on mortality from a comfortable palace. He wrote them while the Antonine Plague ravaged his empire, decimating a third of the population and claiming his own children. He realized that when you cannot control the disease, you must control your response to it. Ancient Romans did not have the tools to eradicate illness. They met it with household traditions, temple prayers, bloodletting, and battlefield surgery. They did not defeat disease. Survival was not victory. It was just delay.